The American Heart Association depends on the time and the talent of many volunteers to keep research and science moving forward towards the goal of creating a healthier world. You are listening to this presentation because of your interest in volunteering your time and energy within AHA's science and research enterprise. So let me tell you about the Lay Stakeholder in Science and Research Initiative. Funding research is a cornerstone of the American Heart Association's life-saving mission, a pillar of our foundation and a key to our future. Since 1949, the AHA has made significant annual investments in research, which have led to breakthroughs in cardiovascular and cerebrovascular diseases and brain health research. This year's significant milestones include $5 billion invested in scientific research. The American Heart Association is the nation's oldest and largest voluntary organization, uniting more than 33 million volunteers and supporters with a shared focus on improving heart and brain health. As the largest source of funding for cardiovascular disease and stroke research next to the federal government, the AHA is committed to funding cutting-edge science and building careers in science and research. The research findings made possible by the AHA donations are translated into guidelines, which give healthcare providers the medical advancements and knowledge they need to most effectively treat illness. Every person deserves the opportunity for a full, healthy life. As champions of equity, by 2024, the American Heart Association will advance cardiovascular health for all, including and identifying and removing barriers to healthcare access and quality. The ASA, American Stroke Association, significantly invests in research programs and grants, advocacy in different forms, health communities, databases, registries, and roundtables with other CEOs, to name a few. By elevating the focus of our scientific journals, increasing the diversity of our workforce, creating a digital learning platform to be shared by other scientists and professionals, we continue to work towards and strive to improve access to healthcare for underrepresented populations, addressing health disparities, including social determinants of health, structural racism, and rural health inequities. Well, the lay stakeholder or the non-scientists, volunteers, or patients, or caregivers, or advocates, or survivors and family members. They may be thought leaders with an intimate experience with cardiovascular and cerebrovascular disease. They are committed and competent volunteers without formal training as scientists. They want to advance the AHA's mission to be a relentless force for a world of longer, healthier lives. Many different names refer to patient representatives. Sometimes we say volunteer reviewers, lay advocates, but here at the American Heart Association, we refer to them as patient stakeholders, representatives. The association has an inclusive environment with those who serve the organization and its mission. The lay stakeholders in science and research are very much a part of that environment. Well, the role of the lay stakeholders is important. Their contribution adds an outside perspective to research and science, a view which reflects the insights and concerns of patients, caregivers, and community and funders. Lay stakeholders bridge the communication gap between scientists and non-scientists, prompting a sense of urgency to find cures and more effective prevention, diagnosis, and treatment. The AHA developed a framework for the initiative that defined the lay stakeholders, created a volunteer recruitment and training program, established policies, and incorporated those policies into scientific operations. We set metrics and engaged lay stakeholders to foster and work with scientists in cooperation with one another to evaluate their best practices. Well, to learn more about the history of this initiative, you can review the publication written by our lay volunteers in June of 2021. Just visit the Lay Stakeholder link on the AHA website. I'll show you how to get there in a minute. Well, since the conception of the Lay Stakeholder program way back in 2015, we continue to add patient voices in research and science. We learn new and improved methods for inclusion and communication of information. Why does the AHA invest in the lay representatives? Well, the organization believes that lay stakeholders add that outside perspective in research and science. Their views reflect the insights and concerns of patients and caregivers in the community and funders. We briefly stated these volunteers increase accountability, provide real-world understanding. They strengthen the mission of the AHA and give voice to issues that patients feel are important. They provide a wide range of views that patients feel should be brought to the table. They provide an understanding of the benefits and burdens that patients experience. And with that, patients help scientists to guide and actually design and tailor their research. Lay stakeholders add credibility to the workings of AHA research and science, inform others of the human dimension of research and its outcome, and add to scientific statements and clinical practice guidelines. Here we see the areas that lay stakeholders participate in. They participate in peer review committees, research committees and subcommittees, program oversight advisory committees, writing guidelines, groups and statements, research seminars and meetings. They are on various projects in various within the science and research area. Patient representatives have a unique role and are also included as voting members on research and science communities and subcommittees. Well, while there are many research committees, the Lay Stakeholders in Science and Research has its own task force who oversees and reports directly to the National Research Committee. The AHA Lay Stakeholder Task Force has broad responsibility for engagement of lay stakeholders in all aspects of the AHA research enterprise. They assist with the development of strategies, aid in strategies and action plans, explore ways to consistently make known public acknowledgement of lay stakeholders, and review current training methods and explore new methods for improving quality. The Lay Stakeholder Task Force reports directly to the National Research Committee. Up from the committee, their views and thoughts and ideas go directly to the Science Advisory Coordinating Committee, and then up to the Board of Directors. There are 8 members on the Lay Stakeholder Task Force with ideas and thoughts about the initiative and direction of the initiative. I mentioned the website. The website for the Lay Stakeholder Initiative can be found here by going to professional.heart.org. You scroll over to the right-hand side of the screen and there's a link for research programs. And within that those research programs, you scroll down and you see a link for lay volunteers. In the lay volunteers, we have forms and criteria that you must meet to become a lay volunteer. We have a library of newsletters that communicate what our lay stakeholders have been doing and upcoming projects that you might be interested in. We have an interest form that you can fill out so we can interview you. And then we have different PowerPoint slides and presentations that will help educate you in the process. We look for individuals with first AHA volunteer experience, a familiarity with heart or brain disease or disorder. People who have a basic scientific knowledge or systematic approach. Understand a systematic approach. You don't have to be a scientist, and you don't have to understand depths of scientific methodology, but you just have to understand the process and the logic of the process. You have the ability to examine research proposals and scientific manuscripts. Your professional background may or may not be important to us. It depends. Your willingness to abide by AHA conflict of interest policy is very much needed when you take on a role at the American Heart Association. Excellent interpersonal relationship skills are needed. We believe in our partnerships and we respect the people within and on our committees. You must be reliable and have the ability to commit to a project. Well, there's a series of steps that take place before a volunteer can serve on a committee. First, we encourage you to go out to the website and to view the introductory presentation. Then, second, we encourage you to fill in that form, the interest form, and then we will contact you, set up a Zoom meeting, and interview you just to learn a little bit more about you and your passion and your background experience, and we'll ask questions about perhaps your health history so we get a good understanding of who you are. Third, after the conversation, if we are still interested in one another and you have available time to serve, you will be placed on our master list of volunteers that we draw from to meet committee and project needs throughout the year. Once a committee or a project becomes available, a lay stakeholder is matched or selected based on many factors. It might be their age, their health diagnosis, or their volunteer experience, to name a few. We look for a good fit for everyone in order to achieve the best outcome. So a number of people make the final selection of who sits within their committee. American Heart Association is very proud of our mission to improve lives and our code of ethics. We want you to know that we believe in improving and extending people's lives, bringing science to life, speaking with a trustworthy voice, building powerful partnerships, inspiring passionate commitment, meeting people where they are, making an extraordinary impact, and ensuring equitable health for all. So we are very proud of our code of ethics and our values. Volunteering for the AHA is exciting, and you be eager to tell others, but the information you will be reviewing and hearing before, during the meetings is confidential. You cannot share this information with your family or friends, and definitely not with social media. In some cases, you will need to remain silent on the information entrusted to you. At other times, you'll be notified when you can release and talk about the project you've worked on. But maintaining confidentiality of information entrusted to you is essential. Because others' well-being may depend upon it. You are required to keep confidential all information you hear. That means no blogging, no social media, and no discussion, even with your family members or friends, about the area you're volunteering for. Did I say that twice? It's because it's very important. We want you to be honest and ethical in your conduct, including ethical handling of actual or apparent conflicts of interest between personal and professional relationships. Remember, you will be an important part of the committee if you're selected for a project. If you accept an invitation to serve, the committee is counting on you to be present. Through our long-standing support of scientific research, the AHA has propelled breakthroughs that have saved and improved lives. We've long supported scientific research in our fight against cardiovascular, cerebrovascular, and brain health disorders and disease. We're making a difference. The research we've funded through the generosity of our donors is helping more and more people survive. Our core research programs have launched or furthered the work of many of this country's brightest researchers, and we've added research awards that foster team science and accelerated discoveries. Again, we believe that every person deserves to live longer and healthier. Our mission assignment is to be a relentless force for a world of longer and healthier lives.